CLOTTA is made from natural chicken collagen and is activated by contact with blood, and it binds to the receptors in damaged cells in the blood vessels. This activates a major cascade of chemical reactions throughout the body to provide a scaffold for blood to start clotting. This is different from other hemostats, as it not only helps to clot the bleed via pressure, but also by promoting an increase in the natural body's reaction. It works in extreme conditions and is fully biodegradable. CLOTTA is ideal for a range of wounds from catastrophic bleeding to minor cuts. Although made from chicken collagen, the risk of an allergic reaction is very unlikely, as the intensive diafiltration process during the manufacture removes most of the allergens. CLOTTA is not affected by external temperatures. It can be used in temperatures from -95 to +55 degrees Celsius, unlike other products with a narrower effective window. Once you apply CLOTTA, it's advised to apply direct pressure on the product until bleeding stops. However, you can use additional assistance in the form of a tourniquet to help stop the bleed. When you use CLOTTA, you should only need to use one sponge on each wound. You can easily tear the sponge if you want to and put it onto different wounds, and you can also pack the wound if needed. There are two sizes of CLOTTA to use on small and large injuries. CLOTTA does not cause an exothermic reaction, so it should not cause harm to the patient. Ideally, place the perforated side of CLOTTA against the wound, but ultimately it doesn't matter which way you place CLOTTA on the wound, as it's just collagen. Unlike other hemostats, CLOTTA clots the blood and doesn't just stop the bleeding. CLOTTA is vital for every first aid kit. You can buy CLOTTA direct from ProTrainings Europe on our store at firstaidonline.co.uk, contact us for more information on supplies at protrainings.uk, or phone 01206 809 538.